Dear friends, I'm Dr. P.P. Bose. I'm a senior consultant pulmonologist. I'm the founder of SARS Foundation, and I work for a couple of corporate hospitals like Fortis, National Heart, Merchant Hospital, and I'm telling you something very interesting. This COVID has been a very bad times. All of you must have experienced, and this is a disease which affects your immune system. So those who have a poor immune system, especially the poor host, those who have comorbidities like diabetes, those who are in immunological suppressant, those who are on steroids, and those who have a very poor sedentary habit, they are always at been risk. I have found in my 3 years of clinical practice, those who have a poor immunological subsystem, they are at a high risk of COVID complications. Similarly, we had the tuberculosis. And tuberculosis is a disease which we handle in plenty. Previously, I used to see a lot of tuberculosis in poorer sections of society where the nutrition was poor. One lately, I'm finding the tuberculosis, all the sections in elites also, it's coming in a big way. The reason being, we don't take care of the host. Tuberculosis, something like a COVID, is a host versus parasite interaction. If the host is not healthy, you get this tuberculosis in a very all kinds of forms. Despite the fact that in universal immunization program, we are immunized when the day we are born, but still tuberculosis is not settling down. It's coming in all forms. It's open tuberculosis or gland tuberculosis or pleural disease. But as a pulmonologist, I see a lot of gland tuberculosis, a lot of pleural effusions, a lot of pleuropericardial disease. The reason being, our host is not very healthy. And one of the reasons for poor host, as I mentioned, is your alcoholism, poor diabetic status, and India is being a diabetic capital of the world. So if you don't take care of your comorbidities well, so these hosts can get all kinds of tuberculosis. And pleuropericardial disease is a reactivation of your old tuberculosis, which we have in a low dose as a part of vaccination protocol. So it's not that you get this tuberculosis disease from somebody, it's your own disease which gets activated. So my dear friends, tuberculosis, whether it's a gland tuberculosis or an open cavity tuberculosis or a pleural disease, it has to be treated properly. And tuberculosis, the mycobacterium tuberculosis, is a very pleomorphic. It doesn't come in one form. It's not like one bacteria. It comes one bacteria with so many forms. That's why we call pleomorphic. Some are rapidly multiplying, others are slowly multiplying, some are persistent, and others are dormant. So it's very important that whosoever treats your tuberculosis, the physician or the pulmonologist, he should be knowledgeable enough to use the right regime. It should be in the right dose and in empty stomach. And the first 4 drugs, the part-changing drugs, the WHO guideline says that these 4 bactericidal drugs, the rifampicin, isoniazic acid, pyrazinamide, and ethambutol, they work in unison. And if they are given the right doses in empty stomach with a lot of pyridoxine in your diet, so you can take care of a tuberculosis in first 2-3 months. And first 2 to 3 months are very important because they are the intensive phase of tuberculosis. That is a time the tuberculosis can get converted. Your sputum get converted into seronegative. So when you really want to convert your tuberculosis, open tuberculosis and negative tuberculosis, your intensive phase should be very good. So 4 drugs is minimum, and all those who had previous tuberculosis, sometimes we add 2 more drugs. And dear friends, never add single drug. Always add 2 new drugs to your existing regime. That is a guideline. So sometimes those who already had tuberculosis, those who have been very irregular with your regime, we normally give the 6 drugs. The standard drugs are rifampicin, isoniazid acid, ethambutol, and pyrazinamide, but you can add ofloxacin and streptomycin. These are standard guidelines. If they don't work with this, get your sputum and organ biopsies done, then probably we have to go to the second line drug. So overall, dear friends, you should not take the tuberculosis lightly. With the right regime, with the right dose, your comorbidities are equally important. Whether you're COPD, whether you're diabetic mellitus, or you're on steroid supplements, or you're in any other habits, like especially alcohol. Those who are into alcohol and tuberculosis, their drug effectiveness comes up because bioavailability of the drugs come down if you're into alcohol. So don't get into substance abuse. Have a healthy life. Do regular exercise. Maintain an ideal weight, and follow the good rules. So if your host is healthy, the parasite will not be able to damage you. So friends, follow the right rules and try to avoid tuberculosis. If you already had tuberculosis, follow the right regime and go to the right specialist for the guidance. Regards, Dr. Bose.